All right, thank you everyone for joining us for our monthly Ambassador Zoom. My name is Ben Shlesinger. I work in the Government Relations Department doing advocacy, and so hopefully all of you have worked with us on advocacy before. If not, we're welcoming you all with open arms and look forward to working with you in the future. And for today's briefing, Melanie will give an update of state legislation, and then Martin will go over the 37-mile challenge. So without further ado, Melanie, if you could unmute yourself, and then you can give the state update.
Hi, everyone. Thank you for joining us all today. As Ben mentioned, we do a lot of state policy work across the country, and this year has been unexpectedly very busy. To give you an idea of what we're doing right now, we are working on 124 pieces of legislation in 40 different states. And so far this year, 6 of those bills have actually been signed into law already. We work on a ton of different types of legislation. So, for example, I know many of you on this call are familiar with our work on the Living Donor Protection Act. It's a bill that's been pending at the federal level, but while lawmakers at the federal level are working on moving that forward, we've taken the language to state lawmakers so that folks living in states, in certain states that pass these bills, can get those protections before hopefully that becomes law for everyone in the country. So this year, the first piece of legislation for the Living Donor Protection Act that was signed into law was in Kentucky. The law is currently awaiting signatures from the governor of New Jersey, the governor of Pennsylvania, and the governor of Washington State right now. So great news there. And then we work on another piece of legislation called a CKD task force bill. That bill has been introduced in 8 states already this year. And what it does is create a task force of people in individual states to study kidney disease in those states, with the ultimate goal of making legislative recommendations to lawmakers for things they can do to try and decrease the incidence of kidney disease and promote education around kidney disease in their individual states. We also do work beyond the Living Donor Protection Act to support living organ donors, things like tax credit bills for uncovered expenses associated with the organ donation. We are working on a number of paid leave bills for people who choose to donate organs. So paid time off from work to recover after this life-altering surgery. Those bills are pending in Hawaii and Minnesota right now. So if any of you live in those states, let me know. We also work on Medigap bills. I know many of you are familiar with how Medicare works as it relates to ESRD patients. About half the states in the country don't require insurers to offer Medigap coverage to people who are under 65 and ESRD patients. So we are working on a number of pieces of legislation across the country to close that loophole, to ensure that ESRD patients under 65 can access Medigap coverage. We are working on some health disparities bills. We work as well on bills to try and ensure that through our HIP program, that insurers are required to accept our direct payments on behalf of patients. And then we also work on bills in coalitions. So for example, some of you may be familiar with accumulator policies. We work with a massive coalition of patient groups throughout the country to try and put those types of bans in place, as well as Medicaid expansion to increase access for patients, not just ESRD patients, but all patients. And then a new piece of legislation that we've started working on this year is an anti-discrimination in transplants bill. And it's specifically for people with disabilities, though we are hoping to expand that in the future to include protected classes of individuals in discrimination, to prevent discrimination in transplants. So it's a robust policy agenda in the States. If you have a question about what we might be doing in your state, please contact Ben or I, and we can certainly provide you with information. We always welcome help from our advocates and ambassadors. I can tell you that the 4 bills that are already on governors' desks, including the one that has already been signed into law, is in large part due to folks like you contacting your lawmakers and asking them to move these pieces of legislation forward. So thank you for all of the work that you have done, and we look forward to working with you in the future.
All right, thanks a lot, Melanie. And now I'd like to welcome Martin McNutt from our fundraising department. And he will talk to us about the very exciting 37-mile challenge that he has coming up.
Fantastic. Thank you for the introduction, Ben. I will go ahead and share my screen if that's okay with you here. I have prepared just a few slides to kind of walk. Somehow I got muted, so I'm hoping you guys can hear me now. I'm going to go ahead and share.
Yeah, I can hear you.
Perfect. All right. And now can you see my screen?
It says Martin McNutt has started screen. Yeah, here we go.
Fantastic. All right. If I can get this out of the way, I'll go ahead and get started here. Okay. So as Ben mentioned, I'm going to go ahead and talk to you a little bit today about 37-mile challenge, which is something we launched last year and something we're going to be diving into this May. We're getting people registered for that now. So just kind of wanted to tell you all a little bit about this new and exciting platform that we have. And before I do that, though, I wanted to share with you just a very brief slide about Kidney Nation, which is our online fundraising platform for individuals and groups. They're looking to raise funds to help fight kidney disease. Many of you on this call may already know about Kidney Nation, so I won't spend too much time on it. But really, this is something that we developed about 60 years ago for people who are interested in raising money for the American Kidney Fund programs and services that will help patients. These individuals and groups have interacted with Kidney Nation in a few different ways, whether it's people creating an event, a community event like a trivia fundraiser night, maybe a backyard barbecue, something along those lines where they can bring their local communities together and collect donations to help patients. Some people choose to honor loved ones who may have been recently diagnosed with kidney disease, or maybe someone they've recently lost. And others might pledge their day, where in lieu of their birthday or in lieu of their kidney transplant anniversary and getting presents, they ask people to make donations to a fundraiser that they create through our Kidney Nation platform. So it's been growing year over year. We've had great success with it. And invite any of you that might be interested to reach out to me or visit kidneynation.org. The overall impact, obviously, is money that's raised through the Kidney Nation platform, enables AKF to serve more patients with our financial assistance and other programs, such as research and advocacy and the other things that we do. So before I go too deep into this conversation today, I had a couple questions. And if you'd like to answer them, great. You can just drop your answers right into the chat. No need to unmute and verbally state it, but just curious, a couple of questions for you here. One, have you you folks here on the call here ever participated in fundraising before? And if you have, was your fundraising kidney disease related, or was it for maybe another cause? So take a few seconds and just drop your answers right in the chat if you'd like to. And while you're doing that, I'll just mention, for those of you that maybe have not fundraised before, but might be interested in doing so through a Kidney Nation or through our 37-mile challenge, it's not something where it's expected you have done this before or know what you are doing. We do provide you all the tools necessary to have a successful fundraiser. If it's through the 37-mile challenge, it would be on a Facebook platform, and we use Facebook Messenger to give you fundraising tools and coaching tips. If it's through our Kidney Nation platform and you're doing a community event, for instance, I'll work with you directly and get you fundraising toolkits and answer any questions you have and get you any materials you need. So I see a lot of activity in the chat, although I'm having a hard time seeing. Oh, wait, here we go. Fantastic. Looks like there's a lot of activity from folks that have done fundraising before, also for kidney disease, but also for other causes. So glad to hear. I mean, I know we have a very interactive community here. I'm glad to know that everyone is out there doing something great. So a little bit back into Kidney Nation. We had a program called, well, we still have a program called 5K for Kidneys that we launched in 2016. This is something along the lines of those community events that I was talking about, something we saw that there were people across the country that were looking for something kind of in their backyard to do. And noticed that people wanted to put together these community events like 5Ks where people could come together, get medals, you know, if they win their age group and that sort of stuff, but generally come together, raise awareness for kidney disease and raise money for patients that really need the help. We had a dozen 5Ks that spanned across 5 states and raised a little over $125,000 since 2016 through 2019. We were getting some momentum there and that was looking really great. And then COVID happened. So when in-person events started to be canceled and we needed to look for other opportunities to do, we came up with a pivot and created the 37-mile challenge. And this was a way to bring the kidney community together online and have them walk or run virtually 37 miles during 1 month time span to honor the 37 million Americans living with kidney disease. And while these folks were taking this walking or running challenge of 37 miles, they could create individual fundraisers and help collect donations, whatever they could, no amount's too small, that would go towards a collective $37,000 goal towards American Kidney Fund patients to programs and services that would help patients in need. So last year when we did this, we set it up with a format where people could join a Facebook group, a closed Facebook group, just like the AKF Ambassadors Facebook group that you have. And these folks would be focused on the 37-mile challenge for that month. And as you can see in the top left there, participants will be able to track their miles. It's self-reported. So you just go right into Facebook Messenger and a little chat bot will come up. You'd type in how many miles you did and it would let you know how many times you've walked or run that month so far, how many total miles you've accumulated, and how many miles you have to go to reach your goal. Now, 37 miles might, depending on you know, who you are on the call, it might sound like a very easy task. It might sound like a very difficult task. I do want to pause here and just mention that this is suggested mileage. Some people might go double or triple this amount. Some people may only walk what they can a few times a month just to be a part of the group. And anything in between is totally okay. But obviously we have the 37 miles to tie into the 37 million Americans. So that's what we've come up with. And we have this chatbot here to help you track those miles in Messenger. As I mentioned, obviously this is a fundraising platform. So everyone's invited to create their own individual fundraiser and collect donations in any amount that they can. They will go towards our overall goal for the group. We have individual leaderboards as well, and a thermometer, like for instance, that you see here, that we'll keep on posting so people can see not only their individual progress and celebrate those people who are doing really well, but also can see how they're contributing to the overall goal for the campaign. And then what's great about this, what was sort of an unexpected benefit from this, is that this Facebook group gave an opportunity for everyone to be posting in there and sharing their stories, sharing their inspiration, and encouraging people to continue to move on and go on towards their individual and our collective goals. It was a really fun thing to see. I think there's a few people on this call that participated last time, and later on, if they'd like to, I'd love to have them share a few words on that. But it was really great to see the kidney community come together online when we were all sitting at home being safe and doing something to help the overall community and share our stories and come together. We provided a few incentives and a few really cool things for people who were participating as well to kind of add to the fun. On the left, you'll see this is someone who crossed the finish line, who completed their 37 miles, and we provided a little filter that they could take a selfie with their phone and they could post it online showing that they completed the challenge. And on the far right, you'll see a Kidney Nation t-shirt that we provided to people who raised $200 or more for the group, as well as a Kidney Nation pin and a bracelet that we mailed out to everyone as a thank you for, again, reaching that fundraising threshold. And then it was really great to see not only the posts that I mentioned earlier about people encouraging everyone to keep going and sharing their stories and inspiration, but people would also post about how amazing and awesome the experience was and how much they pulled from the experience of hearing from everyone else and doing their individual miles. So it was a great campaign for us last year. We really enjoyed the outcome, not only of bringing the community together, but all the impact we were able to have on the kidney community as well. So we decided to bring it back, of course, for this year to do it again. And you're invited. We have our next 37-mile challenge will be this spring, starting May 1st. We've already launched it and it is live. So technically you could join the Facebook group now. And again, I think there are a couple of people in this group that may have already joined. But if you haven't and you might be interested about it, I definitely would recommend going to the Facebook group and joining and seeing what it's all about. We'd love to have you. How to get started in particular would be to join our Facebook group and opt into the Messenger platform. So when you go to the Facebook group, you'll join, but then you also opt into our Messenger communications and then start your fundraiser. It's pretty simple. There's some instructions pinned right on the Facebook group there. Again, this is to run or walk 37 miles or whatever amount that you would like to walk or run in May to help us raise this collective goal to honor the 37 million Americans living with kidney disease. The challenge, of course, as it says, is just the start, because when you join, as I mentioned, you'll be connecting with that national community. We already have almost 650 people in the group so far, with another 8 days or so bringing people in. So we expect to have a really robust group of people, again, sharing their stories and inspiration in that Facebook group as they're completing the 37 miles throughout the month of May. And obviously the overall impact, you're all here because you know about the great work that the American Kidney Fund does. You advocate for us on the state and federal level, and we greatly appreciate that. So you know what is important to the American Kidney Fund, how we're patient focused, and how our programs and services are patient focused. So the funds raised from this, of course, is going to help more patients get healthcare coverage, more patients have financial assistance, and be able to get the treatment-related costs taken care of that they may not otherwise be able to without our assistance. Obviously, our advocacy efforts and education efforts and everything else that we do is all impacted by the money we raise through Kidney Nation and through the 37-mile challenge. One of the cool things I mentioned, I did show you a picture of the t-shirt that we had last year. We actually have a 37-mile challenge branded t-shirt this year. So anyone who joins and raises a minimum of $200 in this challenge will get one of these t-shirts mailed out to them, again with a pin and a bracelet as well as a thank you from us. We'll have other incentives for people who go above and beyond that as well. So it's not only fun to go out there and do something healthy to raise money that's going to be for a cause that is truly close to your heart, but you also get some fun, cool incentives like this as well. So that's all I had prepared for you today. I'm more than happy to take any questions. I saw some in the chat that I couldn't quite see, so maybe there's some waiting for me already. But if you'd like to unmute and ask any questions, please do. We do have the link to go to learn more. You can visit kidneynation.org/37-mile-challenge to learn more about that and potentially sign up, or you could just go straight to our Facebook page by typing in 37-mile challenge into the search box there. And also there's my name, title, and email address. If you have any questions that you don't want to ask necessarily on this call here, you can feel free to shoot me an email. I'm happy to open a dialogue and answer any questions you might have about any of our fundraising initiatives or the 37-mile challenge specifically. So with that being said, I will stop talking at everyone and open up the floor to see if there's any questions that I can help out with.
So everyone has been muted. So if you have a question, you can please just unmute yourself and go ahead and ask. But I will say that I did the 37-mile challenge last year, and to be honest, it was way more fun than I thought it was going to be. I don't know the last time I had done 37 miles in a month, but it it was a good experience. And I also liked from the Facebook group, people would post their own updates. They would show different things they had seen on the walk. A lot of folks did their walks in the morning, so people would post different wildlife and stuff that they had seen on their routes. But it was definitely a great community, in the Facebook group, and seeing everyone post everything. And also one of my coworkers, Mike Spigler, he lives exactly half a mile from me, so I would start each walk with just going to his house and back, so I knew I at least had 1 mile for the day, and then continue a little bit more from there. So I don't know if anyone else has AKF employees living a half mile from their house, but yeah, I do recommend just finding sort of an easy landmark. So if you're able to do only a half mile, 1 mile, quarter mile, 2 miles a day, just having that quick, short, easy route back and forth.
I have a quick question. When I go to Facebook, there are 2 different groups called 37 Mile Challenge. One has 636 members, one has 2,500. Is there a difference between the 2 groups, or which one should we join?
Yeah, no, it's a good question. Actually, we just unarchived the old one with the one you're looking for to answer your question is the 636.
Okay.
That's our current one that we're launched for May. And you'll see in the banner photo, it'll say walk or run in May for the 37 miles. So that's the one. The other one you saw was from last year's. We briefly just today, actually, I'm realizing now, unarchived that group so that we could message to those people about this one as well. So normally that one's not visible, but today it is for that reason.
Great.
But yeah, no, great question.
Thanks. Somebody asked the question in the chat, is it open to anybody who wants to join, or does it have to be just like an AAKP ambassador kind of thing? Because I have relatives, or my son, he runs and walks every day, and I think that it might be a really good thing for him if he could participate.
An absolutely wonderful question. This is 100% open up to anyone who wants to join. This can be for patients, this can be for loved ones, this can be for healthcare workers, this can be for people who are just learning about kidney disease and may not be personally affected by it, but want to do something to just help other people. There is no prerequisite for who you are or where you're coming from to participate, just that you join and have fun and help us get towards our overall goals of helping the kidney community. So I would invite not only all of you to join, but bring in your families, your friends, absolutely anyone else you think that might have fun getting out there, doing some miles in May, doing something healthy for themselves and something fun for themselves, but something that will greatly impact people who need it.
Martin, we did have a question about if the 37 Mile Challenge accepts international donations.
So the donations are made through Facebook, so they should be able to. That is a good question, though. I see that now from Ralph.
Yeah.
Ralph, let me connect with you separately about that specifically. I don't have the best answer. I don't want to provide some incorrect information on the call here, but it's through Facebook, and since Facebook is international, I imagine it should happen. But let me double check, and I'll let you know about that.
All right, Martin, we have another question from Kyle, if it's only on Facebook or if it's on Instagram also.
So the actual challenge and tracking will happen on the Facebook space. So I believe you can collect donations though through Instagram, but if you want to be a part of the challenge and track your miles and be a part of the actual fundraising on there, there'll need to be a fundraiser created through Facebook, and you'll need to join the Facebook group and opt into that messenger experience. Facebook is the easiest way to do that, although people can certainly promote anything on other channels as well, but people will need to make those donations through your Facebook fundraiser.
Yeah,
maybe what you might want to do too is when you find out the answers to like that international thing and other questions that have come up, perhaps after our call today, when you do like a summary or send out the information, the links or so forth from our call today, you could provide some of those answers within that so that everybody knows.
Absolutely. Yeah. Okay. Any questions, we'll make sure we get that information out, send the link out to the page where people can, so you can just click on the link and click and join the group if you're interested as well. Any other questions from anyone?
We got one here from Jonathan Trailer. It says, when I go to the link, it takes me to Messenger, but doesn't populate anything. How can I report my miles?
Sure, good question. So Jonathan, first of all, thank you for joining the campaign. I saw that you're up and running, so congratulations on getting your first few donations there as well. And thank you for coming back. I believe you did last year. So the miles reporting will start on May 1st. So right now, if you're set up in Messenger, you should be fine. And once we do start on May 1st, you'll see a prompt. It'll ask you, you can just click on menu and type in however many miles you did that day, but it won't start logging anything until May, which is why you're not seeing that yet. Okay. Great question though.
We have another question here from Kyle about, is there marketing graphics and collateral that can be shared on social media accounts that we will be providing, like different graphics and things that can be shared on YouTube, Instagram, Twitter?
Yeah, so as part of that Messenger experience, there will be some fundraising tools to get pushed out to you. So there'll be some shareable items. There are going to be some links to some stories you can share that may help, or some shareable facts that might help motivate your donors to contribute to your campaign. I'm also happy to work with you individually for a more robust or more individualized plan if you'd like. I am on Facebook, and we can certainly connect through Messenger and can guide you there. Or you can shoot me an email, and that was in the presentation, but I'll make sure as well that we send it out in the follow-up email that we send. I'm happy to have a conversation with anyone about some strategies that you can use while doing the 37-mile challenge to get information in front of potential donors and share your story as inspiration to motivating people to jump up and join the cause with you. So there is stuff baked in. To answer your question again, there will be stuff that will be periodically served through Messenger to prompt you for fundraising, but also to coach you with some tips and shareable items. But doesn't have to stop there. We can come up with a more individualized plan personally if you'd like to connect with me as well. These are good questions. I didn't know what kind of questions we'd get, but I'm glad that we got some good, thoughtful questions from the group for sure.
Sure, and folks who have questions, even after the chat, definitely feel free to reach out to me, or you can reach out to Martin as well, and we'd be happy to assist you here.
Absolutely.
Right, any other questions about 37-mile challenge? Because if not, then we will conclude the recorded portion of this briefing, and then we will switch over to the Q&A time. So if there's no more questions, I'd like to thank everyone for taking the time to join us today. And we will be posting the link to this recording on the AKF Ambassadors Facebook page. But now I will stop the recording, and then we can go to our Q&A time. So thanks again, everybody.